Exchange. We will be recording this event, so if you do not want to be recorded, you can either turn off your camera, or else you can also leave the webinar. But it is a recorded webinar. We hope that you will stay and enjoy. So we will begin now. Welcome to the Menstrual Hygiene Online Learning Exchange. And it really is around, this is the International Women's Day month. I would say March is the month, and it's really around advancing women's rights. And we're looking at it from the perspective of menstrual health and hygiene and sexual reproductive health and rights. And so I'm pleased to be part of this. The WINS Network, as many of you know, is a global affiliation of different partners. Our core group members are UNICEF, GIZ, Save the Children, WaterAid, and many other organizations. We are an interagency network, and our efforts are really to harmonize the efforts around WASH in schools, as well as to support ministries of education to improve their services by aligning efforts of all development partners and NGOs. So within the WINS network, we have a number of working streams around advocacy, policy, system strengthening, monitoring, reporting, resource evidence, gender, including MHM, so hence this webinar today is very much linked in our global cooperative objectives, as well as general WINS programming, knowledge management, capacity building, and learning exchanges. And many of you perhaps participated in the most recent learning exchange in Côte d'Ivoire, in Africa. So that is the WINS Network, and we're very pleased to host today's webinar. And just to let you know as well, you can join as an individual or you can join as an organization. Please go onto our website, WINS Network, .org to get more information. So with that, I will go on to the next slide. Great. And I've also started to introduce myself. My name is Belinda Abraham, and as I mentioned already, I'm currently supporting the Global WINS Washington School Secretariat as part of the WINS Network. I also work with an NGO, a German-based NGO called Viva Con Agua, supporting them on institutional fundraising and programs. And I work as a consultant doing a lot of work on Washington schools. And so I'm pleased in my capacity here today as part of the WINS Network. So, as many of you have seen already, we have a packed agenda, and I'm really pleased to have inputs from UNFPA, UNICEF, and GIZ, so colleagues from Nepal, as well as colleagues also from Pakistan and the Philippines, from the Ministry of Education, and also from UNICEF in Pakistan. So we're really pleased to have all the participation today to make it a very rich session. The session objectives are first to showcase, I would say showcase, or maybe to discuss a little bit the interface between menstrual hygiene and health, as well as sexual reproductive and health rights. And we want to really kind of understand what is this interface between these programs. And I think we have great experts who can speak to it today. We will also look at what are the potential avenues for programmatic intervention. And we're really getting examples from Nepal. We'll learn about initiatives from different countries around MHH. And then we will also discuss and provide, hopefully, a platform to discuss strategies that can be implemented in various countries. So we hope it's a rich discussion, and many of you, like myself, are probably coming from more of the WASH point of view and coming from MHH from a WASH point of view, but this is really an opportunity for us to see it in the wider context of rights, of sexual reproductive and rights, and also some of the other linkages our programs also can more maybe actively support. So this is going to be an interesting session in that, kind of getting us to think outside of our boxes. And I guess for those who are already in the sector, perhaps looking at how these linkages can be further strengthened in our programming. Good, so we have a very full agenda. We'll start with a presentation by Miss Radha Paudel. She will talk about menstruation and child marriage, and very much interested in learning more from her work as part of the Global South Coalition on Dignified Menstruation. A very fascinating and interesting topic. And I think for those of us who look at wash and rights, I think this whole kind of rights-based perspective and sort of the bigger context in which menstruation is, and I think she will shed not only some very interesting light, but actually a very interesting discussion for that. Then we'll follow that presentation uh, on the menstrual hygiene, health, and hygiene, sexual reproductive health rights interface. This will be done by Abhiram Roy, and he is working with UNFPA. He is actually the Comprehensive Sexuality Education Project Coordinator. And I think he will also bring a bit of a better understanding about this concept again of comprehensive sexual education. Then we will then follow that by ours truly, Sami Pandey, who will talk a little bit about MHH and SRH, our program integration, and she will speak very specifically to activities in Nepal. After each of these presentations, there will be a 1 or 2 minute questions. I really, throughout the whole presentations, really encourage you to put things in the chat box to share. We will have two reactions, one from Pakistan from Mr. Kamran Neem, who is with UNICEF under the WASH Climate and Environmental Specialist. And of course, ours truly, again, will have a reaction from the Philippines, Dr. Maria Corazon Dumlao, who is from the Bureau of Learners Support Services in the Department of Education in the Philippines. And then after that, an open forum for all of us to discuss and some synthesis on my side before we close. So a packed agenda. We started a little bit late, so we probably might go a bit late, but we hope you find it fruitful and also engaging. So I've introduced the presenters, and I will introduce them again more with detail before they speak. But now to introduce yet again of our own, Dr. Juan Alfonso Leonardia, and he is with GIZ Philippines, and he will say a few starting words to kind of set the stage for this. So, Doc, over to you, please.
Thank you very much, Belinda. Yes, I'm Juan Alfonso Leonardia. I'm formerly regional program coordinator for the Fit for School program for almost 12 years now, and now currently working on a project that focuses on advancing girls' rights through improved menstrual health and hygiene. We co-organized this session together with the Global Washington Schools Network. Well, aside from the fact that we are working on menstrual health, is also to somehow explore why, as Belinda said earlier, the interface between menstrual health and sexual reproductive health and rights. Because it seems, in my experience as a WASH practitioner for the longest time, it seems that menstrual health has been seen in many ways. No, it's like the six blind men and the elephant. And then sometimes menstrual health is seen as a waste management intervention. Sometimes it's seen as a hygiene, water and hygiene facility intervention. Sometimes it's seen as a rights intervention or a gender intervention and also a health intervention. And and it's strange that it's somehow treated differently depending on how you look at it. And it seems that the future holds a lot of potential for maximizing the synergies with sexual reproductive health and rights. And for this session, we wanted to hold this session so that we could all go gain better insights on how to maximize the synergies between the two topics and to improve our programming and delivery service delivery strategies to better communicate our advocacies and also for better stakeholder management, as there seems to be a large interface in that aspect as well. So yeah, I'm very excited for the show to start. So I hand it over back to you, Belinda. Thank you to everyone for your interest.
Yeah, thank you. Well said. And I guess highlighting again, how can we bring our synergies together for greater impact? I think this is what we want at the end of the day. So with that, I'm going to start. I will quickly just show my slide and then I will hand it over to Radha. So I would like to introduce Radha. Radha is a lifelong rebellion. I love it. For dignified menstruation from Nepal, and she's trained actually as a nurse. She is founded the global network for Global South Coalition for Dignified Menstruation, which is really around changing the narratives around menstruation globally. Despite experiencing, you can imagine, many threats and challenges, including funding, which is also a good way to quell initiatives, they have managed and they've succeeded and initiated an International Day of Dignified Menstruation, which is the 8th of December, which has been in place since 2019. It's also being marked over 56 countries in 2022. She continues to write about the topic of dignified menstruation through books, both in Nepali and English, and she has received recognition for her activism and her work, her literary work. And as she will share with us in her presentation, but she believes that dignified menstruation is an innovative and holistic approach for changing the landscape of gender equity and rights, I'm going to add, if you don't mind, globally. So with that, I'm going to end my slide share and welcome you to begin. Radha Paudel, welcome. We look forward to hearing from you. Thank you. So Radha, are you able to share your screen now? It's on to
Yes,
you. Perfect.
I'm trying to do it, but I don't see it. Yes.
I think it's coming up now. Perfect.
Do you
So
see me?
I see it perfectly clear. Just put it on full slide and I see you too. Beautiful. Thank you so much.
It's not. Okay. Yes. Yeah.
Yeah, perfect.
Thank you, Belinda. Namaste. Salam alaikum. Good morning, good afternoon, friends. Thank you so much for having me. Most importantly, for acknowledging the importance of discussion on nexus between menstrual discrimination and child marriage. It is very difficult to share everything on a given time. Therefore, based on study and practice of Global South Coalition, I will share about menstrual discrimination and its influence on child marriage very briefly. Global South Coalition is a survivor-led global network based on Global South for changing narratives around menstruation from hygiene to dignity, from 5 days bleeding to life cycle approach, and it initiated in 2019 and is part of the Radha Paudel Foundation. The Secretariat Office is based in Nepal, and we have a steering committee members from Nepal, Philippines, Sri Lanka, Pakistan, Malawi, and USA. And if any of you like to get the membership of ours, please go through this link. It is available in our website. It's a less than 1 minute business. Global South Coalition defined the menstrual discrimination. It is an umbrella term. Includes the taboos, signage, stigma, restriction, abuses, violence, deprivation from services and resources associated with menstruation throughout the life cycle of menstruators. That means girls, women, trans men, and queer. It is a form of gender-based violence and violation of the human rights, and it has been practicing across the globe with the different names, forms, magnitude. It is a complex and multifaceted. And as you all know, the child marriage is defined as a formal and informal union before the age of 18. In this connection, Global South Coalition reviewed the policies and practices from 3 countries which have the highest rate of child marriage. Bangladesh is the first country of child marriage in South Asia, whereas India is the second country, and Niger is the highest, has the highest rate of the child marriage in Africa and globally. We also reviewed the policies and practices related with the network which are working for ending child marriage. The South Asia Initiative to End Violence, which is based in South Asia, and African Union, which is based in Africa and working through 55 member countries, and likewise the Global Network for Ending Child Marriage, Girls Not Brides, which is based in London and working around the globe. Through the literatures and the review of 3 countries and 3 networks, the drivers for child marriage are the absence of or low education, poverty, harmful practices, including female genital mutilation, tradition of family honor, trafficking, displacement, inequitable social and gender norms, disasters, including wars, pandemics, COVID pandemic, as we all know. And by going through these drivers, the menstrual discrimination is missing driver globally. And likewise, while we review the interventions for ending child marriage, most of the intervention globally, not only the three countries or 3 networks, focused on engaging communities, families, policymakers, faith healers, enhancing the purchasing power of the parents or providing the different kind of livelihood activities to the parents, developing the skills of girls like providing the scholarship, bags, cycles, insurance. It varies from project to project, country to country, and providing the comprehensive sexual education in order to retain the girls in school, and likewise fostering the legal and policy framework for child marriage. And while reviewing these interventions, we see the missing factor. This is the dialogue on dignified menstruation. And if we go through the 3 countries, in terms of the menstrual discrimination, there are several types of menstrual discrimination which are visible, invisible, and related with the touch, food, mobility. You can see the few examples over here. I don't like to go through it because I believe that you all know about it, including the Philippines. If we go through this menstrual discrimination in this way or in a pictorial form, while the menstruators are unable to toss the water source or forbidden to cook or entering into the kitchen or not allowed to the religious activities or not allowed to eat milk and milk product, we need to think where is the right of dignity of them. Likewise, right to food, right to participation, right to freedom. So while they are following the restrictions, their human rights constantly violating. And the same idea, looking from other perspective, while the menstruators are practicing one form of menstrual discrimination, the multiple forms of human rights are violating. You can see, for example, if the menstruators are not allowed to eat fruits or food during that time, the right to dignity, right to equality, right to freedom, right to non-discrimination, right to food, right to health, right to educations are violating. And during the 5 days of the menstruation, they experience 100 types of restriction, the silence, ignorance, and you can calculate to what extent their rights are violating. This is the very complex slide, but I love the most one. You can see the both the menstruators and non-menstruators feel safe, free, equal until they are about 6 to 9 years, based on the culture. And when they knew something about menstruation from their mother, from movie, from grocery shop, the menstruators feel little bit second. They start to feel unsafe, insecure, inferior, control, and powerless, though they are not in menstruating phase. They are only the 6 or 9 years old. And whereas non-menstruators continuously think more safe, more free, more superior, more powerful. And when the menstruators have a first time menstruation and then they lose their confidence, they feel more powerless, more control, more inferior. And whereas the non-menstruators continuously feel more safe, more power, more pure, more privilege based on the context. And when they see the mensurators at home, at family, at the community, at the schools, and it gives them more power to feel that they are the more powerful. And this is how the menstrual discrimination construct and shape the power and patriarchy. That power goes in a spiral way and that perpetuates the patriarchy. And this is how during symptomatically during the menstruation, perimenopause and menopause, the menstruators experience more violence. And the same idea I like to show in different way. Between 6 to 9 years, they knew something about menstruation, and between 6 to 12 years, they start to feel it, powerless and powerfulness. And this is how it constructs the power and patriarchy, and the home is not safe place at all. It's a shadow pandemic. And the UN claimed that the 1 in 3 women experience the violence globally, but Global South Coalition claimed that this is not true, because yet the menstrual discrimination account is a form of sexual and gender-based violence. And also the menstrual discrimination is a root cause of for violence against the menstruators. So we need to change the narratives, the understanding, the mindset, whatever we have right now globally. The same idea I like to share in different way again. The menstrual discrimination is like the knobs in our body. It influences throughout the life cycle. From home to tomb. And if you see in the global south, the sex selective abortion is happening, and in the global north we can see the gender pay gap. Whatever the case, many people consider that, oh, this is the different two issues, but for us it is not the two different issue. It is the one, because the underlying cause is the same, because the menstruation. And there are so many discriminatory menstrual practices, and that is why the women or menstruators considered as a weak, and they are getting the less salary, or they are terminated when their sex is identified. So I don't like to go through all, but it is easily understandable. Just in needs of the whether it is a half glass empty or half glass full. So it depends on you, and I offer you to choose by yourself. And here, this is the glimpse of the 24 hours of a girl or menstruators. It's not only about the pad or the facilities. She has to wake up early in the morning to manage her blood, to follow the different kind of practices depending on her culture. And there is a silence at home, silence at school, and she constantly has to focus on her managing the blood, whether it's leak or not, wearing the different layers of the trousers, panties, pad, and have a dispute with the family members, friends, and constantly she's working for her managing the restrictions, the discrimination. And then because of that, she is so stressed, distracted, not attentive in class, sometimes pretended sick, sometimes she may experience the premenstrual symptoms, sometimes severe premenstrual symptoms like PMDD, and this is how she has a low performance, and she remain absent or leave from the school. And this is how the 5 days in a month or 60 days or 2 months in a year, her education interrupted, and she failed in a class and drop out from school. This is how she trapped either in voluntary or the forced child marriage. And that kind of things we are missing globally. We mostly focus on the infrastructure, the product, but meantime there are so many menstrual discriminatory practices are surrounded at home, at school, at community, at workplace, and everywhere. That kind of part is missing. And this is in this connection, the holistic approach is a dignified menstruation, which is a state of free from any forms of menstrual discrimination, including taboos, stigma, shyness, abuse, violence, deprivation from resources and services associated with the menstruation throughout the life cycle of the menstruators. And it's a kind of sad. These kind of things are not recognized, not addressed by the international human rights instrument. Since last 75 years, Human Rights Declaration, CEDAW or CRC or the SDG. Even the CEDAW talk about the menstruation under the umbrella of the traditional harmful practices, and it only focus on the some part of the Nepal. So that doesn't include or cover the entire population who are menstruating, and the practices around the menstruation, particularly the discriminatory practices. So many of my colleagues claim that those who are working around.
Yeah, Red Hot, just to let you know, there's about 5 minutes. Sorry to interrupt, but it's about 5 minutes, but I'll let you decide how you want to go, maybe shortening the questioning time. It's super interesting. I'm really enjoying it. Just want to let you know. Okay,
I'm
perfect.
calculating for 14 minutes, so no worry about it.
Okay, perfect.
And those who are working around the SRHR, if we go through the SRHR strategy or framework, the menstruation is like everywhere, but nowhere. Without having the knowledge or confidence or dignified menstruation, menstruators cannot decide whether they have the safe sex or unsafe sex, or they can say no for child marriage if anyone purpose. So that kind of things we need to consider. And likewise, many of my colleagues claim that those who are working around CSE, comprehensive sexual education, they claim that they are working on the dignified menstruation. That is also not true, because the menstrual discrimination construct the gender norms. So we need to be clear. And those who are working on the violations, the menstrual discrimination itself is a violence. It is a main root for causing the violence. That is why we need to be very clear. And the current CSC framework doesn't really cover the or addressing the menstrual discrimination. It depends on the individual difference, but by the format, by the guideline, by the training manuals, doesn't cover or doesn't dismantle the menstrual discrimination. And in this connection, the Global South Coalition marked the 4th International Dignified Menstruation Day, 8th December, under the theme of Dignified Menstruation for Ending the Child Marriage. And we conducted two international conference in Nepal and in Sri Lanka. And it was marked over 56 countries all around the globe. And while talking about the menstrual discrimination contributing for the child marriage or menstrual discrimination is constructed the power and patriarchies, we have been facing particularly 3 types of challenges, because the donors are talking about the survivor center approach all the time, but they still hesitate to acknowledge the stories and leadership of the survivors, particularly those who are emerging from the global south. And the actors who are working on the global south, they are not ready to unpack or not ready to reflect their deeds, because they are so much colonized with the thoughts from the global north. And because of the limited funding, the research, the publication interventions are not only the compromise, also excluded by the survivor phobic syndrome and colonized mindset colleagues locally and nationally. So the way forward is, I like to ask with you all, have you ever imagined the place without the mensurators? If you are working in agriculture or infrastructure or hygiene or sports or decent work, whatever the case, can you imagine without the mensurators? I'm sure no. And in this connection, the urgency to incorporate the dignified menstruation is the way forward, because the dignified menstruation is not only for the 5 days of the bleeding. It's not about the poverty or not about the illiteracy, and also it is not about confronting any religion, ethnicity, country or region. It is a very innovative and holistic approach to dismantle all forms of menstrual discrimination and strive to challenge the patriarchy. And Global South Coalition for Dignified Menstruation believe dignified menstruation is everyone's business, It is a matter of the human rights for over 50% of the population in this planet in all settings. And if any of you like to know about the dignified menstruation, you can find in website, YouTube, Facebook, Twitter, Instagram. If you like to have the books, you can find the books in as a book chapter, is a full book. It is available in Amazon and other firms as well. And I urge you all to have a dialogue on dignified menstruation. It's a really high time to speak on it. Thank you very much.
Thank you, Radha. And please stay with us for a bit because I'd like to open it now to some reflections or questions on the presentation from participants. We often call this chat, listen, and exchange. So you can either raise your hand or you can put your questions on the chat. And Radha, I want to really thank you again for a really enlightening presentation, is particularly for those of us who are coming from the WASH perspective. As you clearly say, it's not just about pads, it's not about infrastructure. It's much bigger and wider, and taking it from a discrimination rather than a resource or thing then gets to really the heart and the issues of things. And so I really, really appreciate that. So many things resonated for me when you talked also about, and I'm hoping this will instruct some other people to think too, when you talk about from the womb to the tomb, and you kind of show that slide where you show all the various points of which menstruators' life is affected, as well as the one also I found very interesting was the one when you talked about the ages between the non-menstruators and menstruators, and between from the 6 to the 9, that age group where they feel the freedom, they're very open, and then they go through other changes because then the societal, the gender norms, everything comes to them. But even what's interesting to me is that anticipation. When a 9-year-old girl knows that I'm going to be menstruating, the anticipation of what that might be for her also has an impact. So I feel this was very, very enlightening on so many levels. And I love that last slide when you do talk about the phobias, the colonized mindset, the zero funding, all instruments to kind of, again, not bring the subject, to not deal with the subject of dignified discrimination, which is really at the end of it comes down to discrimination. So these are also instruments to not move it in the right direction. So it was super enlightening for me. I'm opening it up again. I don't see any hands. In the presentation, but do you want to have some reflection?
Confused.
No, I don't think it's confused because I'm often confused. So, and I completely understood it. Not only did I understand it, I actually then I want to say one last point that comes out to me too is this issue around discrimination is really linked and underlying to all the other rights we work for. So when we're talking about rights for health, when we're talking about rights, other rights, these are all kind of impinging. And I think this is also something. So when we talk about the rights for water, we need to consider these rights because they're all linked and they all allow the realization of rights. So I think this is what came to me from this presentation, and I'm sure others took a lot from it as well. I see some comments from the doc as well, who says it's innovative perspective to change the social construct of menstruation, and it's a positive one. So thank you very much for that. So perhaps if there isn't direct questions or hands or reflections, I can't see it on my box. Then I will thank you very much. And I'll also again draw people again to your website, the website you did, www.dignifiedmenstruation.org. It's a great website with lots of resources. And really, I think as practitioners, whether you're coming from the health or the WASH, or you're coming from sexual reproductive health, or you even talk about the comprehensive sexual education. To understand that there is a wider connection that we need to consider in our program, and we again have to move from our very narrow view to understand that it's a rights-based, it's a discrimination, and addressing those. Until we address those, we will never get to the real realization and freedom of all persons. So thank you very, very much, and please keep in contact with Radha. And I know you have to go at some point, but hopefully you can see the recording, especially the reflectors input, because you did say some pretty some pretty insightful things, like the current programming is not addressing this. So I hope the reflectors will also kind of maybe speak to that too. So thank you very much. It was an excellent presentation. Thank you. Okay, so with that, then I'm going to show my slide, and then we will go to, so I apologize, I'm just going to have to move a little bit here with my slides. Go to the next one. We will go on now to, apologies. Okay. We're just, sorry, I have to go through it. Maybe I just end the slideshow for 2 seconds, and then we will go to the presentation. Apologies for this. Okay, maybe we can show this. So maybe I need to also, yeah, maybe you can begin. I'm just going to show, unfortunately, it's not letting me to move as quickly as I want. Let me just move down here. Okay, oops. Okay, I can't show my screen anymore. If it's okay. Okay, now I'm just going to put on the sound, because I have to put on the sound for yours. Apologies. We are getting here. Okay, so I think this is better. Before I move it to the slideshow, this is better. You see. Ah, technology can't be lost. Thanks for being patient. Okay, so Abhiram Roy, he is our next speaker. I'm very pleased to have him join us from UNFPA Nepal office. He is a public health professional with over 12 years working experience in the health and development sectors in social and economic development. His core focus has been adolescent sexual reproductive health and rights, and so very much in line with this topic, as well as maternal child health, menstrual health and hygiene, gender equality, and women's empowerment. And he also focuses on gender-based violence and the comprehensive sexuality education, which we've just talked about. He's currently, as I mentioned, working with UNFPA and taking a lead in the planning, management, implementation, and monitoring reporting of this program. So very, very pleased to have you join us, and I will pass it on and just let me know. The floor is yours now.
Okay, thank you so much. Thank you so much, Belinda, for these introductions. And thanks to GIZ for giving me the opportunity to present UNFPA initiatives actually on the menstrual health and hygiene, sexual and reproductive health and rights, and comprehensive sexuality education. So good to see, like actually, like having Radhaji presenting on menstrual health and hygiene, like you talk lots of issues when Radhaji talks about menstrual health and hygiene. So my presentation actually will be more focused on intersection between menstrual health and sexual and reproductive health and rights, and the key approaches that UNFPA has initiated for the promoting and improving the menstrual health and hygiene and sexual and reproductive health and rights for young women and girls. So maybe like we can go to the next slide, Belinda. Okay, thank you. So, as you all know, like UNFPA is an expert UN agency, like working on sexual and reproductive health and rights from a long period of time, where UNFPA ensures that sexual and reproductive health and rights for all, especially for women and girls, in all their diversities, their rights are respected, protected, and fulfilled. So this is the main focus of UNFPA. If you see in this diagram, like UNFPA key goal is to like achieve universal access to comprehensive sexual and reproductive health, realize reproductive rights, and accelerate the progress on the implementation of program of actions of ICPD. So all the interventions that we do, we ensure that there is universal access to comprehensive sexuality educations, and the ICPD program of actions are accelerated. So the focus of UNFPA is on women, adolescent, youth, and those furthest left behind. And the focus is for these groups are to empower them with the knowledge, attitude, and skills to protect them, protect their health, well-being, and their dignified livings. Actually, so and the context that we walk in is in humanitarian settings and also in development setting. So all the works that we do is to ensure that the government's systems are strengthened and government's capacities are developed for delivering of comprehensive sexual and reproductive health and rights, sexuality education, and ensure that menstrual health and hygiene products are promoted in schools, health facilities. So this is the overall things that I would like to say from here. Now I would like to take you to the initiative, what actually UNFPA does. So if you see, like, as you also see, you saw from Radha's presentation. So among many harmful practices that is prevalent in Nepal, UN Working Group on Ending Harmful Practices has identified 5 major practices with the highest prevalence in Nepal. And if you see menstrual restrictions, including chaupadi, which is an extreme form of menstrual exclusion, has been identified by UN to focus on ending these harmful practices, including gender-based violence, including others like caste-based discriminations are there, child marriage, dowry, witchcraft, gender bias sex lessons. Among these harmful practices, we are also prioritizing our efforts to reduce gender-based violence, including harmful practices. And we have, like, if you see the UNFPA's 3 transformative results actually focuses on ending harmful practices and like zero gender-based violence and harmful practices, where we ensure that menstrual exclusion doesn't exist in the community. So this is our actually goal. Now I would like to take you to the intersection between menstrual health and menstrual health and sexual and reproductive health and rights. UNFPA has a very good technical briefs that has been developed on the integration of menstrual health into sexual and reproductive health and rights policies and programs. So based on that brief, and as you all know that there is a milestone declarations and program of action, ICPD, program of actions, which is a milestones on sexual and reproductive health and rights. And if you see, like ICPD not only defined SRHR, but also defined menstrual health. So if you see the in the presentation, how ICPD defined menstrual health is a state of complete physical, mental, and social well-being, not merely in the absence of disease or infirmity in relations to menstrual cycle. It does include that. It says in relations to menstrual cycle, in a whole life cycle approach, in which women, girls, and all the people who menstruates experience a positive and respectful environment with free from stigma, psychological stress, and where there is a full resources to support the needs of the people who menstruates and who can make have choices on their body and can make informed decisions about their but bodily autonomy and sexual and reproductive health and rights. So this is like very clearly it has been mentioned in ICPD program of actions about how it does looks when we talk about the menstrual life cycle approach of like the menstruation. Now, the linkages that I would like to draw on menstrual health and sexual and reproductive health and rights, there are various ways that we can interlink MH with SRHR to influence the experience and expressions on sexuality, bodily autonomy, and health-related decisions making. So there are like, especially I would like to say three linkages that I would like to draw. One is definitely, like you also saw from Radha's presentation, is completely linked with social cultural related things, where because of the stigma, side discrimination that is attached with sexuality, that is attached with menstruations, often hampers or becomes a barrier for women and girls and the people who menstruate to have access to information, access to services related to sexual and reproductive health. So there is a need for dismantling menstrual stigma and transforming harmful social cultural practices and norms, uh, which is a vital for achieving also a vital for achieving sexual and reproductive health and rights and gender equality. So this is the one linkage that we can. So in all the cultural, social cultural practices we see, because it is attached to sexuality and menstruation, there is a hindrance in sexual and reproductive health and rights and ensuring realizations of the rights among the menstruators. Another link is definitely with the biological linkage between menstrual health and sexual and reproductive rights, which is sometimes linked with the family planning services. There is an intersection between menstrual health and contraceptives because of the sometimes menstrual, sometimes hormonal induced family planning services also have impact on the menstrual health and hygiene, or say menstrual cramp, overbleeding among the people who menstruates. And another link is that I would like to draw. Menstruation is the intersect of education, health, gender equality. So so if there is no linkages between uh, uh, between between menstrual health, sexual and reproductive health, education, then there will be a lack of information among the menstruators to access knowledge, informations, not only related to menstrual health but also related to the overall sexual and reproductive health of the people. Now, let me take you to the legal environment, the policy environment that we have currently in Nepal. Actually, the government of Nepal, Nepal is a bit progressive in terms of legal context. If you see the Right to Safe Motherhood and Reproductive Health Act 2018 has very clearly mentions the right, like the rights of young people to have comprehensive SRHR information, education, and services, which ensures that the women who menstruates do have uh, have right to educations and take SRHR services in a free and a non-violent and non-discriminatory ways. This is ensured by the Act. Nepal is also a signatory to several international human rights like treaties and others laws, which ensures like and guarantees women's rights to equality and non-discrimination, and no women's and the girls and the people who menstruate should be discriminated based on their menstruation practices. Also, the SDGs goal 3, 4, and 5 do have targets related to sexual and reproductive health, ensuring there is universal access to sexual and reproductive health services, including commodities, family planning services. So there is the way that we can make government accountable to us, ensuring the rights of the women and girls. National Adolescent Health and Development Strategies very clearly actually talks about the education for girls in schools, talks about safe learning space for the girls, and also talks about adolescent friendly health services. Now, let me take you to draw your attention to the National Curriculum Framework and the School Education Sector Plan, which is a milestone. This is if you see the school education sector plan, this is a 10 years plan that Ministry of Education had developed, and also a national curriculum framework, which is a recent new curriculum framework 2020. uh, like UNFPA together with several other like UN agencies, development partners, NGOs, INGOs, civil society organizations actually participated and in the policy drafting process and ensure that the issues of menstruations are included in the curriculum, so that there is a well teaching and learning practices among the students to talks about the menstruations issues, is their rights, sexual and reproductive rights. And if you see in the school education sector plan, there is a very clear indicators that defines like how government is going to ensure the rights of girls and menstruators to have access to the menstrual commodities and supplies, ensure vast issues in schools, and ensure that girls and adolescents have access to comprehensive sexuality education. So this has been explicitly mentioned in the school education sector plan and also integrated in the curriculum. But as Radhaji said, menstrual health and hygiene related issues, comprehensive sexuality education issues, although the major components has been integrated, but it's not as per international standards. So moving to next slide now. Belinda, can you move to the next slide, please?
Okay, it's been moved. Can you see it? Still not? Okay, go back and I bring it again.
Sorry, I can't hear you.
Sorry. Yeah, can you not see it? It's showing on my screen. I'm just wondering why it's not showing on yours. It is showing. Maybe if we can
No,
get a thumbs up.
no,
It's
it's talk on legal context.
okay. Can others see it, or let me just move it? Can
Oh, yes,
Yeah,
yes,
it
it's
is
What we
moving
see
now.
now
visible.
is,
Now,
yeah.
now
you
it's
see it
moving.
now? Okay.
Yes.
Okay.
Okay, so
So
let me, yeah, so actually, I think we have moved to another slide. Let's go to the slide before this.
yeah, it's on my side. It's showing. Maybe is this something in my? What slide do you see?
It
Others?
talks about the strengthening coordination mechanism, but before that, we have advocacies like policy advocacies related issues.
Okay. How
All
about
right,
this
right.
one?
Yes, thank
Okay.
you.
There we
Thank
go.
you.
Great.
So,
Okay.
UNEP ensures that policy actually supports governments in policy advocacy and technical supports to integrate menstrual health into sexual and reproductive health and CSE related policies and programs, which as already briefed that school education sector plan and education like curriculum already integrates MHM and SRHR issues. Is we also ensure that building institutional capacity and strengthening service delivery and quality of cares actually. So we support governments to certify AFICs, like adolescent-friendly health services, to establish adolescent-friendly information corners, and build the capacity of teachers to deliver CSE in school and out of school. We also ensure that there is a capacity developed for health service providers to to support and provide services in a friendly way. We also do ensure that SRHR services, including menstrual health and hygiene, menstrual commodities are supplied during humanitarian crises. Like we supply menstrual kit, dignified kits, kishori kits during the humanitarian crisis situations. So the next slide, please. Is it moving, Melinda?
It is moved on my side, and I feel there's a bit of a delay. Do you see it now? Strengthening coordination?
No.
Okay,
I
this
hope
is a
other
little
users not seeing it. It's taking
okay.
time actually. Yeah.
Okay, I go back again.
Yeah, it's now. It's done now. Yes, it's
Yeah, but now I
moving.
have to go back. Sorry. I don't know. There seems to be a lag. Okay, so now do
Okay.
you see it?
Okay. Maybe. Yes.
Okay. All right.
So
Go.
creating enabling environment to create demand for comprehensive sexuality educations, SRHR services, and improving menstrual health is also a key initiatives of UNFPA, and raising awareness and empowering women and girls to claim their rights, to empower them to make informed decisions about their health and well-being is also a key interventions that we do. We have a very innovative packages that we have developed. Is called Rupantaran, is adolescent social and financial skill packages. That's we do implement a rollout for the students who are out of schools. That's in girl, mostly out as in girls. And Rupantaran has 15 models, and it has a model and menstrual health and hygiene. So there is a different models on health and hygiene. There is a different model in sexual and reproductive health and rights. So we do practice this for the girls who are out of school. We do also promotes the issues related to menstrual health and hygiene, and sexual and reproductive health issues through a social media. And we promote, we mobilize the champions, the motivational speakers through TikToks, to promote and engage young people through social media, and also through our innovative community outreach. Like we do form girl circle in a community where, like if you see in a COVID context, these girl circles played a vital role actually in terms of raising awareness, and to also act as a counselors for the young women in the community. So this slides that showing on your screens is a bit integrated and holistic approach for promoting and improving menstrual health and sexual and reproductive health and rights. uh, the things that we as in UNFPA we do, if you see, the first one is we talk about adolescent friendly health services actually, where we support the national mechanism to ensure that adolescent responsive health systems are strengthened and scale up to make it youth friendly, so that the needs of young people, girls, and all the people who menstruates are fulfilled. By saying that our AFS, adolescent friendly health services, like we do have, we supported the government to develop this AFS guideline. We also support the government in certification of adolescent friendly health services, providing trainings to the health service provider, and ensuring that the like the supplies such as dignity kits are available in the health facilities, and have young people have access to those supplies. Another interventions is that I would like to take you more deeper in CAC and Rupantaran bit here. You can see the interventions that we do through CAC is like definitely not only supporting the government in ensuring that the curriculum content contains the component of sexuality, including menstrual health, but also we ensure that the teachers are capacitated to provide uh, uh, there is a proper teaching and learning practices among students on the issues related to sexuality and menstrual health and hygiene. So there is a community of practices that we adopt at the community level, where the teachers, where the good practices, and they share among the teachers about the pedagogy that used for teaching CSE. We also provide mentoring coaching because it's the issues of sexuality is taboo and stigma, so it's not that openly talked within a class. So we ensure that the teachers who teaches the topics related to sexuality, health and physical educations are well capacitated and addresses the queries of the students. So this is like there is a mentors and mentee practices that we do in a school setting, and we there is also a teachers learning online teachers learning platform that we have created especially to discuss on the CSE matters and the issues related to sexuality. Another interventions that we are doing by establishing a multi-purpose model AFICs. We call it multi-purpose model AFICs because we do support these AFICs with the ICT materials like computers, boards, where young people can go and access and have access to internets, and they can learn from the internets as well in mentorship of the teachers. And we ensure that there is the materials related to menstrual health, materials related to sexuality, and components are regularly supplied to AFICs. And this is a safe learning space for the people, adolescents in schools, and discuss about the sexuality in schools. We do also have knowledge of is an online platform to discuss and to learn about the issues of sexuality, sexual and reproductive health. We do integrate school health and school nurse program with health facility and school, so that young people, the students has interactions, and there is a linkage between school and health facilities. As I said, we do ensure that there is a supplies of menstrual dignity kits, Kishori kits during hematology session, and also provide services to the young people and ensure that they are referred to the health facility if there is a need, and counseling, even the psychosocial counseling needs are there. We have a psychosocial counselors in schools and health facilities and OCMC. So we ensure that there is a linkage between school, community, and health facilities. Now, moving to next slide, let me go and summarize you through a very uh, uh, the good practices that we adopt in UNFPA. Melinda, the slide is not moving. We can go to the last slide, and which talks about the best practices, the summary of the best practices that we as in
Do you see it
UNFPA that we
now?
have.
Do you see it
No,
now? Still not.
no,
Okay.
yeah,
This is
it's
very
not actually.
strange. Okay,
Oh,
it's
it's
stalling.
there, it's there, it's there,
Now
it's
you see
there.
it? Okay.
Yes.
Okay.
So
So now
first thing
maybe we're
that,
just wrapping up because a few
right,
minutes.
yeah,
Yeah.
this is
Yeah.
the
Okay,
last
great.
slide that I'm
Thank
trying to
you.
wrap in.
Perfect. Okay.
Yeah. So, so the best practices that I would like to share from Nepal, that as in UNFPA that we have been supporting the civil society organizations, also the governments, to ensure that there is linkage between education, health facilities, and communities. We ensure it through various strategic ways like use of ICT materials and smart projectors, and ensuring that there is a supplies of IECC, BCC materials like information, education, communication materials, and other edutainment materials through our multi-purpose model AFIC, adolescent friendly information corners that we have established in schools, so that there is improved access for young students to the information related to menstrual health and sexuality components. Another is also use of digital platforms and innovative community outreach that we initiated during the COVID, and it's going on as a best practices through establishing a knowledge hub and through establishing a girls and boys circles uh, where we roll out. There is a continuous discussions where we roll out Rupantan, a social and financial skill package for those group of peoples, where they continuously discuss about the issues related to them. We also develop youth initiated web series actually, and there was like last year we had 12 web series developed which were initiated by youth on their issues, and one of the issues was related to menstrual health, and that was promoted through YouTube channels and social media platforms. Another interventions that I would say was very promising, the formation of technical working groups, advocacy coalitions, and youth advocates who continuously ensures engagement with the line ministries for the promotion of sexual and reproductive health, and they ensure that their issues including menstrual health and hygiene issues, menstrual and other SRHR issues are integrated in the various policies and programs, and they do interact with the community to conduct intergenerational dialogues to reduce the harmful practices, to minimize the harmful social culture norms and values. So here, I will stop here. If there is any queries, question, happy to address those. Thank you, Melinda, and thanks to everyone for your presence. Sorry for the
Okay.
technical glitch, actually.
Yeah, I think there's a little bit of a delay, but before we close, and hopefully you can hear it, we want to play the video.
Yeah.
So I will just, and then there seems to be also some questions after that. So just going to play the video.
बृहत यौनिकता शिक्षा केवल
यौनको विषयमा मात्र होइन.
Comprehensive sexuality education
is just not about sex.
So what is comprehensive sexuality education? It's about knowing your body.
It's about having a healthy relationship with your friends and family.
It's about preparing to be a better human being.
यो भनेको कुनै पनि किसिमको भेदभाव र हिंसालाई विरोध गर्न सक्नुपर्ने हो.
यो लैङ्गिक समानताको शिक्षा पनि हो.
It is also about learning to stand up against harmful practices and stigma.
Thank you so much.
Yeah, a great video with those influencers and very much underlying what you were talking about this kind of working with global coalitions, working with other actors, really engaging with youth and young people in mediums that they can relate to. So this is quite a good example of that. So with that, I believe I'm going to stop the share, and I believe there are some questions. There was a hand up, or if there is questions, please either put them in the chat box or raise your hand. I thought I saw one from a hand raised for a question to this presentation. Or maybe it's just taken down now. Yeah, so I hope you're not getting the background noise that I have in my background, but I just wanted to share some of the highlights of your presentation. I think your presentation really showed that there are a lot of frameworks, and especially quite the progressive way in which Nepal has even integrated it into the curriculum. So we do definitely get there are the frameworks there that are available, and it's very much aligned to a comprehensive rights-based approach, and also very much linked to the SDGs. You highlighted SDGs 13, 10, 3, 1, and 17, all very much linked to the SDGs. And the focus of UNFPA's programming on women, youth, and the marginalized, and how you really work on a comprehensive approach, even including humanitarian settings. I think what was very interesting for me was this for me, the intersection you talk about between the socio-cultural, you talk about the three linkages of which MHM is, and which I'll put my camera on here. So, but you talk about these three linkages when you talk about the socio-cultural aspects of it, you talk about the mental knowledge of SRHR, and then the biological linkages, and how basically MHM is basically linking these three. That's the way I understood it. So I think you helped us really understand the linkages of MHM under the wider comprehensive framework that exists, and then really then gave some pretty good examples, first with the legal context, and then the terms of the programming areas. And I think what I probably got most out of it was the best practices. The best practice is that it's not only, it's about supplying materials, supplying information. That's one side. There's also making these digital formats, mediums available for young people, particularly the youth, adolescent-friendly corners, and then also this formation of, again, technical working groups, advocacy coalitions, and youth advocates. So all of these kind of best practices, and again, these help us then to integrate it, also integrate MHM, SRHR in a wider perspective. So these are actually, to me, really clear ways of integration and interface when you talk about the materials, the formats that we work, and then also the coalitions. So very, very interesting. I don't see any questions. I do just see a nice reflection again from Doc. He also really likes, and I agree with that, the intergenerational dialogue, because that's very much the barriers for progress, is around these not having that. And he's asking a specific question to you. Can you give us an example of how this platform has led to progress in MHH or sexual reproductive rights?
Yeah, sure. Basically, like not only links to the intergenerational dialogue, but if you see, like I will start from the school interventions, how school interventions links to community. So actually, these adolescent-friendly information corners, where uh, this safe space for adolescent girls and boys ensures that they have the improved knowledge and attitudes and skills related to sexuality education. Now these, when we provide them also a training like comprehensive sexuality education training to peer educators, and also Rupantaran package to the peer educators and facilitators. Now these peer educators and facilitators, they go to community. Now through their leadership, they conduct intergenerational dialogues with the parents, with the teachers, and other community gatekeepers. Now the thing is, the how is this helping them? If you see the interventions where we have done, where initially there was obstructions from the parents, telling that telling the teachers that what you are teaching my students, you are teaching our students the sexuality and sex about sexuality, these things has gone down actually. Now there is a favorable community environment, community actually approaching the school authorities to teach comprehensive sexuality education in school. There is also a conducive environment in schools where head teachers and school authorities are having a positive, attitude on the aspects like promoting CSE in schools. So this is the one example that I would like to share with you. The favorable environment at the community level. Now teachers and even the parents are not objecting to the sexuality education in the schools, but now they are creating a positive aspects. They are thinking it's in a positive, and this is because of the peer educators, the facilitators who were taught in schools has come to the community and engaged with so many others, community gatekeepers, including parents, had made it a conducive environment to promote comprehensive sexuality education. So this is the one I want.
Yeah, thank you very, very much again, Abhiram. This was, again, really set us to understand the wider frameworks, but also very concrete practical programs which are taking place and how advances are being made. And I think also the interface. So thank you so much again. And please stand by before the question, maybe the wider question and discussion period. We'd like to bring you back in that. And thank you very much for sharing, for excellent presentations. So then with that, we go on to our last presentation before we go into the reflections. And I'm just going to move this. I have a feeling here we just have to go. Okay. So our next presenter is our own Sami Pandey. She works for as a technical advisor for the GIZ support to health sector strategy. She's been doing that since 2019. She has a master's in public health from the University of Adelaide and several years working in public health field in Nepal, and following very nicely the this presentation on adolescent sexual reproductive health, comprehensive sexuality education, WASH in schools, and she's also featured also the work that she's worked with influencers, Kiki, in menstrual health and hygiene areas. So, Sami, I'm going to stop the share because I believe you're going to share your presentation. And thank you very much. And the floor is yours.
Okay, thank you, Belinda. Can you see my slides? Okay.
Yes, I can. Perfect.
Okay. At least I can move it myself. Okay, so good afternoon, everyone. I'm Sami Pandey, working as technical advisor for GIZ Health Project. Today, I am sharing our current menstrual health and hygiene program, but linking with sexual and reproductive health. So before going into the topic, I would like to briefly introduce about our project support to the health sector strategy. GIZ is supporting Ministry of Health and Population to implement Nepal health sector strategy through this project, and it's running from July 2021 to and it's going to end on July 2024. The main aim is to improve access to effective and high quality healthcare services in Nepal, particularly for disadvantaged populations. And overall goal of S2SS is to strengthen the capacity of the institution responsible for the social health protection and healthcare provision of the population. We are working mainly on 4 major working areas. The first one is social health protection, where we are supporting Health Insurance Board of Nepal to for the social health protection program of the Nepal. We are also working for sub-national health management area, where we are supporting local government bodies and municipalities for health sector management. We are also working on a cross-cutting component, that is digitalization, where we are improving access to digital data and information for health sector management. And last but not the least, we are working to institutionalization of the selected approaches for the improvement of reproductive health services. Especially, we are working on menstrual health and hygiene, washing school, and midwifery education program under this component. Now moving into the topic, because my co-presenters had already set the stage on this interface between MH and SRHR. So anyway, I would like to just briefly discuss this topic. Menstrual health is an integral part of SRS, as menstruation and the menstrual cycle shape the understanding and experience of critical sexual and reproductive events across the life course, both physically and socially. In other words, we can say that MH is an important determinant and outcome of SRH. And MH and SRH both have common biological and social determinants, and we must consider these things while designing the program. The biological linkages between MH and SRH include puberty, nutrition, menstrual problems and disorders, contraceptive-induced menstrual changes and menstrual suppressions, vaginal or uterine bleeding, hysterectomies, and menopause, etc. Social determinants that underlie both MH and SRS encompass gender, poverty, water sanitation, and various social cultural vulnerabilities such as age of marriage, work burden, and other harmful practices that exist in patriarchal society like Nepal. And overall, sexual and reproductive health and menstrual health are fundamental to health, well-being, and gender equality. Addressing SRH and MH has impact on various SDGs such as Sustainable Development Goal 3, number 3, good health and well-being, SDG 4, quality education, SDG 6, clean water and sanitation, SDG 5, gender equality, and also SDG 8, that is decent work and economic growth. So now moving into our project, before GIZ is working for many years in adolescent sexual reproductive health. So it's been more than a decade, and especially before 2016, GIZ having working more on adolescent sexual reproductive health, also, and that also included menstrual health component. So we are mainly supporting national policy and program on ASRH for strengthening supply side of ASRH program and also demand generation side. Thus, awareness and information dissemination was done by information, education, communication materials, and also digital forms of it through school and healthcare facilities. And various behavior change communication program was also implemented to create enabling environment to access ASRS services by adolescent. In supply side, we strengthened adolescent-friendly health facilities to deliver ASRS services to adolescents. We also provided trainings to health service providers to enhance their skills and also change in attitude towards the delivery of ASRS services. Especially, it is quite a taboo and stigma to get ASRS services like contraceptives or abortion services by unmarried adolescents in Nepal. We also provided capacity building training to teachers to deliver ASRS topics in class rooms without hesitation. Since 2016, we are working mainly on MHM topic. For this also, like we are supporting Ministry of Health to develop and disseminate various information, education, and communication materials on MHM, such as flyers. This time we are also adopted a digital approach, so we develop numerous videos, radio programs, and also we collaborated with the Ministry of Health in developing Khulduli app. This was also done in collaboration with UNFPA. So we developed this mobile-based app which contains various quiz and questions on ASRH and also includes period tracker. So it's like we are also adopting digital approach. We are also implementing school-based MHM program in 10 municipalities in Nepal. And especially we are providing training to teachers on MHM topic. And also we are providing health education session on MHM through teachers and to also health service providers near to the schools. In aligning with the free sanitary pad scheme announced by government of Nepal in 2019, we also supported in distributing compostable sanitary pads to all the public schools of 2 municipalities in farthest part of Nepal. In terms of awareness raising, we also involved a local film celebrity of Nepal, Keki Adhikari, who has more than 1.5 million followers in her social media pages. So we involve her in awareness raising, especially breaking the taboos around menstruation. So she said numerous post on menstruation and various informative materials on menstruation through her social media pages such as Instagram, Facebook, Twitter. She was also later involved in 2-part documentary. The name of the documentary is Nepal's Menstrual Movement. So, and this documentary was selected in very many more than 2 film festivals such as WHO Health for All Film Festival and also Toronto International Women's Festival. So these are some of the screenshots of the posts shared by Keki Adhikari during the social media campaign. Besides education and awareness raising, we also did something on innovation on menstrual products. So for that, we collaborated with the local municipality and women-led organizations such as women cooperatives and women-led NGOs in farthest part of Nepal. And we set up a compostable sanitary pad units. For that, we imported sanitary machines, sanitary pad production machines from India, along with the compostable raw materials. And the main aim was to ensure availability of sanitary pads in the community and also for socioeconomic empowerment of the women involved in the business. And this was the pilot program that we did in 2 municipalities, but we faced a lot of challenges, especially due to the need of importing raw materials from India. And also we have to pay high import charge, making the final product quite expensive. And it was very difficult to compete with the other commercial non-biodegradable sanitary products available in the market. So we are still like seeking support from government to make the environment favorable for fostering this kind of business in Nepal. However, due to our pilot program, we saw some of the good side also, such as awareness was raised in the community and the community were more open towards the topic. And last but not the least, we also did something on washing school intervention that also includes mental health part. We supported for upgrading and constructing wash facilities, female-friendly wash facilities in selected schools in 2 municipalities in Nepal. And in aligning with the Ministry of Education's working procedure, we also implemented Washington School software program, Washington Schools software program, and that was done mainly to capacitate schools, local government bodies, and also students to take ownership of the facilities and also to sustain the services and facilities in the schools for the future. Based on like GIZ's experience, in implementing this ASRH program and MHM program since many years, I would like to suggest some of the program delivery approach that can be integrated while delivering both SRH and MH program. First one is that the first one would be to ensure the access to menstrual health products and SRH commodities. Menstrual health products includes like various sanitary pad products, and SRH commodities includes like contraceptives, nutrition supplements. So expanding the product choice among the women and girls is very important while delivering the program on this area. A second is ensuring access to quality health services, such as like providing quality health services related to SRS, such as ANC, PNC services, family planning, counseling, abortion services. Besides that, it's very important to also to provide access to allied services, especially like female-friendly wash facilities or gender-responsive wash facilities in healthcare facilities, also in schools and also in workplace. So access to quality health services and facilities is also very important, and that can be adopted while delivering this program. Another is that we all are doing already is providing education information, and that are already being taking place in Nepal, like incorporating CSC components in school curriculum, and also providing SRH and MHM health education sessions in the schools through school health nurse or teachers. So yeah, that is also very important. And another thing is that since social and economic determinants of SRH and MH are common, hence interventions to address and transform gender norms, roles, and power dynamics and creating enabling environments is very important. So very innovative approaches like working with mothers-in-law, involving men and boys for a program on SRH and MHM, also involving religious leaders is very important. So we have to, I think we are already doing that. We also need to find out more innovative approaches to address and transform the gender norms. And overall, collaboration with the WASH, education, health, industry, production sector, women's sector is very important for implementing particularly menstrual health programs. So I think, yeah, this is my conclusion for today, and also recommendation for the program implementation. Thank you very much.
Thank you, Tammy. Thank you, Sami, and for again another a really excellent program to understand how GIZ's programming and partnership is working. And I think you really started by saying that it's a direct support to the Nepal health sector strategy. So it's already under a wider guiding, and I think this is also important. So the the program itself is not, it's not a standalone, but it's very much supporting that. Then you went to explain the elements of that, and very diverse, from supporting the capacity of institutions, which is the core part of the mandate, to looking at issues around even the supply. So you're doing services and supplies, working on the WASH interventions, working with communities through social media, through all these various aspects. So it's a very complex program, which comes in a different side. So you have the policy frameworks, you have also the interpersonal aspects, you have the services, you have the communication and education. But I do like the last slide where you make some sort of suggestions on programming, on programming delivery. So looking at access to services, access to quality of services, education, and also the importance of transforming gender norms and having this overall, cross-sectoral, multi-sectoral approach with different, so from with industries and so forth. So it was a very good presentation to show how complex the subject is, but how you also need to have interventions at various levels and various layers. And I think that really sums up nicely. So again, if there's any specific questions for Sami's presentation, I would happy to see that. It's a rather quiet group today, I'd say. It's either they're just taking it all in or they're waiting for the end for the reactions. Is there any questions to Sami's presentation? And Sami, if also too, feel free to clarify some of my kind of takeaways. But if there is any, I don't see any now. So with that, what we can do is then probably go to next to our agenda. So you can stop your share. And we'll go right into the next part of the presentation, which is now to welcome and let me see, let me just get myself organized here. We go into the reactions, and I believe we don't have, okay. So we'll go into the reactions now, and I would like to welcome first Mr. Kamran Neem. He is the WASH Climate and Environment Specialist with UNICEF Pakistan. So I'm going to come back here. Great to see you. And I apologize, there's a little bit of, hopefully you're not getting it, but there's a lot of noise behind me suddenly. Unfortunately, I don't have right now your bio, but I want to, you've had an opportunity to kind of reflect on the three presentations, and our bigger questions we talked about in this webinar is really to see the interface between MHH and sexual reproductive and health rights. But coming from a WASH perspective, as I am and you are as well, I would love to hear your reactions, and then as well, probably reflections from the perspective of Pakistan too. So Kamran, over to you, and thank you very much for being part of the webinar this afternoon. Thanks.
Thank you very much. I would say that we had three very good presentations, and the best part of these presentations were that they showed some examples how intersectoral linkages can be with MHH, and all three were very good examples and very good learning for us in Pakistan. Although there are a number of things that we are doing in Pakistan as a WASH sector, but there was a lot of learning that we can do, and this was overall a very good webinar, I would say. Starting from Radha, I would say that the presentation was from a very good perspective of looking at the whole the MHH from another perspective of from the right to life with dignity perspective. I think that is one of the basic most fundamental human right, I would say. And if we look at the next generation's right to life with dignity, I think that's a very good approach to look at MHH also. And I also learned a lot from the study because things are somewhat similar, but there was you can see a greater degree of their severity in the region, especially from India. What I think is its relation with Pakistan, that although we have cultural barriers, and but we have also cultural enablers, which UNICEF and WASH sector partners studied, and we are also looking at the psychosocial aspects of how if we have so many menstruators in Pakistan, millions of them, then how things have been working and not collapsing if there are so many barriers and bottlenecks. So then we were able to also highlight some of the enablers also. And there are enablers in the social and cultural uh, environment, as well as from the religion also, and involvement of religious leaders, as we heard from Sami, is very important, and that's what Pakistan we have done in Pakistan and found it very useful. So I would slightly differ that it's like, I think India, Pakistan, Bangladesh all have been colonies in the past. So it's not colonial mindset, but more to do with the socio-cultural and religious arrangements that we have made locally to deal with the issue, and maybe that's how we can look at it deeply. But overall, it was a very good, enriched presentation by Radha. From Abraham, our UNFPA colleague from Nepal, I think another great presentation. And that was, I think, the best thing was to look at the intersection of the menstrual health and the SRH and rights related to it. So adolescent friendly health system is, I think, something which we like to try in Pakistan, which we don't have. Actually, in Pakistan, we have been working as WASH sector together in working groups. And recently, we have actually got some very good feedback from the Ministry of Health that they would be leading these working groups, not the WASH ministry, but working very closely with Ministry of Education, climate change, and WASH related topics, departments. So I think that is something that we'll be doing in Pakistan, and a lot to learn from Abraham's presentation there. We have been using digital platform and formulation of technical working groups, like but I think this was one of the new area that we'll like to venture in. And focusing on the Sami Pandey's presentation, our GIZ colleague from Nepal, another very great angle of looking at it from institutional point of view, because we can only like bring in some new ideas and the way we program, but ultimately it's the public sector stakeholders to take it, and they are right from the beginning. They are correct to make it part of the health services program, social and reproductive health program, and part of the government system. So that's, I think, something which we'll be aiming at also. Uh, we have also used the way they used Kiki Adhikari's celebrity in social media. We have tried with our girls team uh, captains in Pakistan, the football team captain of girls team in Pakistan, swimming champion, and so we had 4 champions with us, and they did these campaigns, and the name of campaign was No Chuti. No Chuti, I think in region people follow it, but it means that you don't need to go for a break or leave school during your menstruation. So No Chuti campaign became very popular in social and digital media in Pakistan. So again, we can see, but we didn't try the film side and the film festivals. I think that's something we should try and involve more celebrities from TV dramas, which are very popular, and film side. One new learning for me was the free pad distribution by the government. Oh, wow, it's, I think, a good achievement in Nepal. We are not closer to that, but we are doing right now. We are doing a study with our private sector partner Centex, uh, and we are trying to look at how the tax reforms can be brought, and we can minimize the tax regime on the sanitary pads. I think that's somewhat an action in that direction too, but to have government program on free pads distribution, I think we'll like to learn more about it. And so WINS wash in schools is standard, and I think a number of work with the teachers, But I was curious to know a bit more about how did they, Sami talked about that they worked with health facilities and nearby schools. So how did they like interact? What was the interface? Did they bring the teachers to the healthcare facilities or go to from with healthcare facilities staff to the school? So that's something I think seems very useful, and I'm sure that we can learn from it. But overall, I would congratulate the organizers for selecting such a good set of presentations and remaining focused on the subject, and a lot of learning for all of us. Thank you very much.
Thank you very much for your reflections. Yeah, and also to show, some of the things that Pakistan has done. You mentioned a little bit about the enablers, how you identified some enablers. Was that through a process like a bottleneck analysis, or how were those enablers done, and which were the sectors involved? That was one point of reflection. The other reflection I wanted to say, which was made in the second presentation by Roy, was around the integration, that it's actually integrated in the Nepali curriculum, which is quite progressive. So I'm just also wondering around the Pakistani curriculum, to what extent is MHM integrated into the curriculum, sexual reproductive rights, WASH, even within the WASH issues in the curriculum, because oftentimes that provides the platform for the intersectoral linkages as well. So just some reflections on those 2 points, one about the enabling situation, and then the second around the curriculum. Can you still hear me?
Yes, I can.
Great. Yeah, thank you. Okay.
Yeah,
Yeah, so if you
thank
could
you
just
very much.
share reflections on that, yeah.
Yeah. So basically, in Pakistan, we used a framework which was developed globally by Emory University, and we looked at different uh, uh, determinants and did the bottleneck analysis to find those enablers within those. So, like I'll share one example. There are two I can say findings from that. One was that we found that for programming, entry point through schools is the best way to, start working with the community. So that was something to start with, and then expanding your program in the community. So that was one learning. The second was that the uh, elder sisters and mothers, how do they teach their daughters, young daughters and sisters, was one of the, you can say, the social safety way of taking learnings from the elder generation to the younger generation. So if that system is working, and then we can see our entry point is with the mothers and the elder sisters, and not the new menstruators directly. And also we found that involvement of boys, just like Sami Pandit said, is very important, because a lot of barriers are influenced by the brothers and fathers at home. So it has to be hidden, as it's not happening in the house kind of situation, and the whole management cycle is within the house or in the school. So it's not in the society or public places mostly. So it has to be, if it is well managed at house and school, then it can be managed very well. So that was the second learning, I would say.
Yeah, and then just quickly, in the curriculum, is it integrated in the curriculum, or is that efforts that Pakistan is working on?
Yeah, it's like you can say a developing subject, I would say, because it's still uh, uh, the way Nepal has opened up. I think we are not still there yet. So, but we have a lot of change happening in the TV and digital media. So the private sector has rather come forward very uh, straight away, not calling it different terms which are symbolic, but calling it periods and coming right in the advertisement and talking about it. So, and that has been accepted by the society. There are no reactions. So that also opens, I think, a room for the development sector partners to learn from this private sector that until you wait to fight the taboo and bring the change and start talking about it, actually you can just jump in and start talking about it and there would be acceptability. The world is changing, and so that's a learning.
Thank you, Kamran, UNICEF's WASH Climate Environment Specialist. Thank you so much for joining us from Pakistan today and for your reflections. It's been super useful. Thank you.
Thank
and
you.
then, thank you. So then over to the Philippines. We are very pleased to have Dr. Maria Corazon Dumlao. She is with the Bureau of Learner Support Services, the Department of Education of the Philippines, and not only an advocate for WASH in schools, an advocate for many, many areas in advancing the girl child, the educators, and also our students and scholars in the Philippines. So Dr. Dumlao, please, your reflections on the three presentations. And I'm really pleased always to meet you. Thank you.
Thank you, Belinda. First, allow me to thank the organizers, the WINS Network, for organizing this activity, and GIZ for inviting me again to this webinar series. Congratulations to our presenters, Radha, Abhiram, and Sami. We are happy to see the progress of menstrual hygiene and ASRH in Nepal and other countries, and of course, we also in the Philippines. As a medical doctor and a public health professional in the Ministry of Education who have been working for 28 years, I strongly agree that education is a key factor in addressing issues on women and children, including teenage pregnancies. And I also, in my experience, understand how social constructs and culture affect and impact the discrimination on women's health concerns like menstruation, pregnancy, and early marriage. Menstrual discrimination and taboos as presented by RADA, like in Nigeria, India, and Bangladesh, are also in the Philippines. But we in the Department of Education have efforts to minimize the discrimination and taboos, and we have gone a long way since. We have integrated it in the curriculum, produced information, education, and social behavior change advocacy materials for teachers and learners as part of the comprehensive WINS policy. Unlike in uh, unlike in Nepal, India, and Bangladesh, in the Philippines, child marriage is also a concern but may not be as big as an issue in the Philippines. In fact, there is a law, RA 11596, which is advocated by the Department of Social Welfare and Development, that promotes the welfare of children and protects them against child marriages. This is otherwise known as an act prohibiting the practice of child marriage and imposing penalties thereof, which was signed into law in 2021. And like the countries presented, there have been challenges to teenage pregnancies. SRH is also focused and priority under the administration to address issues of teenage pregnancy and school dropouts due to pregnancies. Thank you, Abhiram, for presenting how menstrual health and adolescent sexual reproductive health and comprehensive sexuality education are connected. Our efforts in the Philippines are affirmed as we also use the UN SDGs as part of the legal basis for our menstrual hygiene management program under the WINS. We have also established CSA adolescent reproductive health convergence sites to ensure that there are also services made through the referral system. We are pleased that, like in the Philippines, Nepal has taken strides for menstrual health and hygiene and adolescent reproductive health. We also strive to meet global standards in compliance to the SDGs. We are happy to see the MHIEC materials available in Nepal. In the Philippines, we also have sets of life skills-based health education materials available online in the department under the WINS comprehensive policy, and we will post in the link in the chat later. We also have additional resources under the Adolescent Reproductive Health Program of the Philippines. I also thank Sami for her presentation. We are proud that the Department of Education has partners like GIZ, which support ASRH program. The Philippines has benefited from this, like in Nepal, and we commend the direction of Nepal on modernizing advocacy and behavior change. In the Philippines, we also do the same. We also agree that the advocacy is because through the school-based program for greater impact. The Philippines also uses the social media and digital platforms for greater dissemination of campaigns like the MH and other school health programs. I saw that Nepal promotes and supports compostable sanitary pads for environment considerations. In the Philippines, we have been promoting videos and posters on making reusable sanitary pads. Unlike Nepal, we also support wash facilities through efforts in the national and local level. In fact, GIZ is a major partner together with Save the Children, UNICEF, and they're part of the technical working group. So we also utilize this platform for setting standards, for monitoring and evaluation, and generating evidences. In our country, there is a joint administrative order for the implementation of the Healthy Learning Institutions Framework signed between and among the Department of Education, Health, Social Welfare, Commission on Higher Education, Department of Interior and Local Government, Legal Education Board, Technical Education Skills Development, that allow us to synergize and collaborate, set up standards, document best practices, and strengthen our advocacy and program implementation at the school level or grassroots level as part of the setting-based institutionalization of health in the school setting under the Universal Healthcare Law in the Philippines. I have learned a lot in the presentations, which are valuable inputs in our journey for strengthening school health. Again, congratulations to our presenters and organizers, and of course, our moderator and partners for the WINS network. You have done a great job, and more power to the WINS network.
Oh, thank you so much, Dr. Dumlao. Always very inspirational to hear from you. And I think you most beautifully close actually the session in kind of wrapping things up. I think again, what I'm struck by some of your reflections is in the Philippines, so much advances have been made to really translate the global frameworks into national frameworks. You speak very much about, I want to use the universal health care, what's some of the institutional frameworks that have already been implemented within the Philippines, how you are then these frameworks, these sort of the legal frameworks allow then for the synergies with the ministries to work together right down to the grassroots level, right down into the schools. So I really do appreciate the importance of that. And also that the fact that you say that there's a lot that you also have learned from the other presentations and where you see also the synergy. So thank you so, so much for a very, very good and comprehensive reflection from your side. So thank you again. Okay, so with that, then I think it brings us to the close. We are just a couple minutes to close, and still welcome any more reflections on what we've actually, the reflections from the reflections. I welcome that, but also the reflections from the presentation. And when I kind of look back, when we talk about what is the interface between, I think that goes back to our original question. What are some of the interfaces between MHH, and sexual reproductive rights. And we've had a very rich conversation this afternoon. But what we can say is one thing that I think four things come to mind. Mostly I'd like to talk in threes, but four things come to mind for me. One, I think, is obviously the policy frameworks, whether they're global frameworks, which is using the SDGs, and also the national frameworks very much help align that discussion so that it allows then the ministries and different partners to work together because there is a legal basis. The second thing I would say, we talked all about it in various aspects, was this importance about the access to, and I'm going to use access rather than supply, but the access to materials, services, and products. And this is perhaps where we are very comfortable. From a WASH point of view, we're very comfortable to share, but there is actually something more to that. And we have to also look at how do we create coalitions, whether through technical working groups, through youth coalitions, through working with influencers, celebrities, but creating coalitions. I love the example of the Pakistan, how where difficult topics were not so easily taken in by the public sector, the private sector was able to take it and to name it. We also saw the beautiful video from Roy, who showed how different media people were talking about comprehensive sexuality education. So it's being able to take topics which are sometimes challenging and taboo topics and then take them to a forum where people can speak more openly and working through the influencers. And then I think what we got from all of it, all of the presentation showed the use of digital formats or different types of media to allow people to engage. And even if it's community or intergenerational dialogue, all of these allow great interfaces. So I found it a very fruitful discussion, and I'm almost tempted, I know it's not part of the schedule as we close, to bring the doc back in. And Doc, can you close us out with one or two thoughts? I hope I haven't got you in a bad situation, but I know you're always on standby. You see, you're just that kind of guy. Doctors are always like that. They can always kind of get on the. So I'm just gonna, maybe you can close us out with your reflections and questions because it's been, I think there's a lot of thinking. We haven't seen so many questions, but on the thing, but maybe you want to close us out with one or two thoughts just off the top of your head from this really great session. And thank all again the organizers for it as well.
Yeah, thanks also as well, Belinda, before we go for the excellent moderation and for also excellent time management and for bringing out the great insights from the speakers. Yes, it was also very much learning for me. I thought I thought the linkage was very obvious, but I also really like how it brought up issues like social constructs and also how also aside from the interface areas that were mentioned, like that you mentioned, plus of course puberty, nutrition, contraceptives. I think for me my favorite interface area is how it affects really gender norms and constructs. No, that these both menstrual health and sexual reproductive health and rights, the barriers to attaining what we aspire for when it comes to rights are actually mostly gender discrimination, gender biases, and all these all our misconceptions and traditional thinking about how sex should be taught, how should it be discussed and approached, and which leads to barriers to access to these supplies and all and services. So it's great. For sure there are areas for programming that we can all somehow use to revise and tweak our strategies, particularly when lobbying, for example, when we have, like, for example, politicians who have a strong gender leaning, then we can, of course, bring up these ideas thanks to this discussion. So yeah, thank you very much again to everyone and also for all the time. Yeah.
Great. And so with that, you've really again nailed it on the head. And this is why I always bring you in because I know you will do that. Is the linkages between the biological and the psychosocial and the social parts and the construct? And absolutely. So there's work to be done, but we know that together we can do it. The policy frameworks are there. The challenges are also there, but together we can address it from our various perspectives, whether it's health, WASH, education, and legal frameworks. So thank you all for joining today. I hope you found, as I did, this session very enlightening, and we hope to have a follow-up session at the end of May. So hope you'll join us with that. So with that, thanks and have a great day, great evening, great morning, wherever you are. Take care. Bye.
Thank you. Goodbye. Thank you.
Bye.
Thank you.
Thank you.
All right, thank you, Belinda.